Okay, welcome to Arizona ALFA's Women in Leadership. Our guest today is Dr. Lisa O'Toole. Lisa O'Toole is the director of Huger Mercy Living Center with St. Joseph's Hospital and Medical Center. She's coming up on 22 years at St. Joseph's. 20 of those years are at Huger Mercy Living Center. It has directed care. Their focus is dementia care and it's top shelf. Her first degree is in dietetics and nutrition. She started as a dietetic technician registered and has worked for many years as a clinical nutrition or as a food service director in skilled nursing facilities. Lisa started at St. Joseph's as the food service manager, and when the position opened for an assisted living manager at Huger, she transferred to that position. As a human resource person stated, they needed a strong operations manager in that position versus the role of an RN, as our model for dementia care is specifically activity social based. And it's an amazing model. Y'all have to check it out. Her bachelor's degree is in management and master's degrees in healthcare administration. Lisa completed her doctoral program 2 years ago. It took her 7 years to complete, which is a story in itself. Her doctorate's in education with an emphasis on organizational leadership, organizational development. Her dissertation involved a deep dive research into the Arizona model of care, which was a 5-year study related to activity social-based care for persons with dementia. Over the years, she's received countless awards related to involvement with dementia communities and collaborated with ASU College of Nursing, ASU School of Music, and Phoenix Symphony on a study related to music and memory, both qualitative and quantitative. Lisa will be retiring soon. That's very sad for the industry, but very good for her. And moving to Myrtle Beach, she'll be entertaining at her condo on the ocean, and she thinks she hears waves calling. Welcome, Lisa.
Hey, hello, and thank you for this opportunity. I'm excited to be here. And Karen, I want to say thank you to you. I don't know if you get enough thank yous in the community because you give so much to our industry. So I want to just say thank you to you too.
Oh, thank you.
ALFA wouldn't be the same without you.
Oh, thank you. Okay, I know Lisa, and I was telling Mariah about it. Well, I know Lisa. She's like, Karen, you know everybody you interview. You have such a good story. I don't know where to start, but I think we really need to start at your community because it's so unique. And if you have not been there, please go see it. So kind of talk about your setup.
Okay, so Huger Mercy Living Center is actually a 5-acre locked unit. So when you hear the term locked unit, we're directed care. So really we're licensed for personal, supervisory, and directed. We only do directed. We were started by a doctor. He was a psychiatrist at St. Joseph's Hospital for 30 years. His name was Dr. Raymond Huger. When his wife, Frances, was diagnosed with dementia back in the early 90s, there was no assisted living yet. So his option was a psych ward for her or a nursing home. And he said, she's not sick and she's not psych, she's confused. So he donated 7 acres of land to the Sisters of Mercy who run St. Joseph's Hospital. And he said, I will build a campus for my wife. We were lucky enough at that time, there was a 5-year study being started called the Arizona Model. And it was through the Department of Health Services, the Alzheimer's community, and the Alzheimer's Association, the state of Arizona, and the U of A. So Dr. Kazmiak was one of the original people that started the study. And it went from 1994 to 1999. And the whole premise of the study was if you keep people busy and engaged, if they have dementia, you keep them busy and engaged at the appropriate level, 2 things happen. Quality of life is better, cognition stays longer. So we stayed true to that model. I think there was 13 originally, 1 dropped out before the 5 years study was over. We stayed true to that model. So some of the tenets of that model is a 6-to-1 ratio. Now, I know a lot of places say they have a 6-to-1 ratio, but they're including everybody into that ratio, the housekeeper, the cook, maintenance. This is caregiver to resident ratio is 6-to-1, and we stay true to that. Also, it's a prevention model. So we have a nurse practitioner that oversees care here, in addition to a medical director. So having that prevention piece and keeping them people busy and engaged and having 5 acres to walk and wander, it's such a no-brainer. It's so effective, but it's so simple. And we do a lot of education for families too, because families come in, sometimes they're just overwhelmed. You know, they haven't slept, their little mind hasn't shut off for years because they've been watching people with dementia and taking care of them. And, you know, they come in, and I like to call some of our families when they first come in hypervigilant. I'll be honest with you, that's a code word for my staff for crazy. Crazy. Because really they're coming in like, and it's like, oh, you need to take a breath. So when we have a hypervigilant family, we know to take a softer approach with them to really help them get past this, to let them know you can let go now and you can have a life and you can come and visit. And I tell families, be the hero. Come with that McDonald's bag, come with that Dunkin' Donuts milkshake or whatever your loved one likes. Come in, be that hero to them, and you don't have to worry about every little detail. So, you know, having 2 nurses for 48 residents, I have 2 LPNs, they're both phenomenal. And I have really long tenured staff because they love this model. So we hire for heart. I don't hire for skill because I know if you're a CNA, I know if you're a nurse, you have skill. I hire for your heart. Another thing that's different, we only hire CNAs here. So certified nursing assistants versus caregiver, we know that the skill level of a CNA is higher, more education, you know, more hands-on under the board of nursing. Then they have to take that truncated class to be a caregiver.
And your property is, first of all, you have a beautiful chapel
property
because you are faith-based, which is beautiful. But your property is not 100 beds in a community.
No, it's 4 cottages, 12 residents per cottage, a beautiful chapel. And if you look at our chapel, we have beautiful stained glass in there. And when you go in the chapel, you look, there's a plaque in there that says this stained glass was donated from the Sisters of Mercy from the original St. Joseph's Hospital from the 1920s. So you just go in that chapel and you just feel like just everything is so calm. We just, not quite 3 years ago, got a 4,000 square foot activity center, which came in so handy when COVID hit. It became our COVID unit. And I'm going to say thank you to Julie Smith right here, because she was our COVID captain from St. Joseph's Hospital and Barrows that got us through that pandemic with flying colors. I have to tell you, we never wanted for supplies. We never wanted for hands on deck. People were coming out of the woodwork. We had respiratory therapists on our campus. We had nurses, nurse managers. We had everybody on this campus to help us. So we were really blessed being part of this bigger organization where I know a lot of smaller facilities really struggled hard. So we were so lucky that we had all of this great collaborative connection with the hospital.
Well, and I think, I mean, I do want to get to talking about you, but I do think one of the unique things about your property is I remember when we first talked on the phone and you were telling me about your property, and you're like, our residents just kind of, I'm not using the professional terms here, you guys, they just kind of roam around, and at the end of the day we put them all back where they belong. And I'm like, you do what? But you do, because everything's beautifully fenced. It's like sitting at a park.
Mm-hmm.
Because people are just mill about. Was that your idea?
No, that was actually part of the original Arizona model. So when you see some facilities out there that have been bought and sold several times and they have a cottage concept, they were probably one of the Arizona model originals that have been bought and sold and have lost this wonderful program. So with 5 acres here, everything is in a circle. So all the walking paths go behind each cottage, and we always come back to our center, which is a big, huge circle of flowers. And we have like 3 or 4 pieces of Tlaquepaque wind art. If you've never seen Tlaquepaque wind art, it's beautiful. It's kind of pricey. It's going to last longer than me. Trust me, this stuff is like copper or something. It's gorgeous. But all of these different wind arts are moving. And with just the slightest breeze, people just stop and watch this wind art. So if you come up by the chapel, we have a beautiful fountain. You hear water. Every cottage has wind chimes. Then you have the circle of flowers. And then you have hummingbird feeders. And then we have our little bus stop where people can sit and wait for the bus. Then we have our activity center. So we can walk through this whole 5 acres and we never stop anybody from going to cottage, right? Because they live here. So the beauty of having this community, all of our staff know all of our residents. So I'll give an example. I have a little lady named Ursula. I really want to put a pedometer on her. She must walk 20 miles a day, easy. She goes from cottage to cottage. And when she comes to a cottage, what does the caregiver do? Ursula, come here, take a drink, honey. Come here, let me get you some ice cream. Let me get you a snack. Everybody's welcome in every cottage. Nobody has ever said, go that way. You can't come here. You're not allowed. No, 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 no. Everybody is welcome on this community. And that makes that whole community such a cohesive, kind of loving environment where people feel safe. And families are like, I can't believe this place exists.
Yeah, and you've had some pretty famous people stay there over the years.
We have, and I can probably share this because it's common knowledge. So Sandra Day O'Connor had her husband here for several years, loved our model. The Brophy family has had multiple family members here, and we love them because they just donated money to upgrade the chapel a couple of years ago. But they like this model. These people could go anywhere. They can afford to go anywhere, and they've chosen to take their loved one here because of the model. So one thing we do, if you look at
Wait, can I interrupt you? I know this is kind of rude, but I'm going to interrupt you.
Go ahead.
Because I think you have a great model. So I want to word this. I want you to understand where this is coming from. I think you have a great model, but is it the model or is it the leader? Because I've been to buildings and places that are just gorgeous, but it's different. I mean, it's a great model, but it's how over these years have you managed to lead because the Arizona models where assisted living was born,
Right.
that you've led it all these years to continue to grow and evolve. How have you been able to have that vision to grow it kind of a couple years ahead of the industry?
Yeah, I still think we're ahead of the industry, to tell you the truth. To be honest with you, Karen, it's because of my leader. So I report to Sister Margaret McBride, who was at the very beginning of this model and taught me the history and what was involved with this, which piqued my interest, that made me want to learn more about this model. So you want to have a community where everybody feels welcomed and you honor diversity. If you could see my campus, we're the world. We have all kinds of people here. And the beauty is we honor each other. So even our activities are based on that. So we'll do a month where it's cruise month. So every week we're in a different continent. So we have people from all over the world here. So when we do this activity, we say, we're going to honor our staff by, would you be so kind as to cook food for us in our kitchen? Would you dress in your native garb? Would you tell us about your culture? And then, like, we have people from India, from Cambodia, from Vietnam, from the Philippines, different parts of Africa. I mean, people have the opportunity to shine, and they love to share that. And the residents love to hear it. And then there's a connection there. So you have to include staff in everything you do. But another thing you have to do is you have to support them, because sometimes you have to go toe to toe with a family member who might not be so kind. Mm-hmm. So the vision was given to me. I can't say I adopted it from my director, who was Sister Margaret McBride, who is still my boss till this day. So having that mission service kind of mentality, you're always going to do the right thing when somebody's looking or not, because it's just the right thing to do. And look at the population you're serving, very vulnerable. Like, we're blessed to be able to do this every day. That's what I tell staff. If you don't feel coming to work every day is really a blessing, like, thank you, God, you've given me this opportunity to do this, then don't work here. Mm-hmm. Go to McDonald's, go someplace else. Don't work here. Because if you don't feel like coming to work every day is a blessing, you're not going to fit.
Well, you're also very active in the community. If I remember correctly, you have a police substation, which when you put in a substation, where the Phoenix police actually come hang out, was never had been done before. Now I think there's a couple. So what made you, or what gave you the vision to have police come hang out at your community and do work and kind of keep an eye on things?
Well, I'll be honest with you. We had some vandalism. So our neighborhood's not the best. And we have an apartment complex next to us, which is also a little sketchy. So we had some vandalism. Staff had some of their cars broken into, stereos. We actually had a Hospice of the Valley nurse's car stolen from our parking lot. I can't make this stuff up. Granted, she left it running, and somebody got it and took off, but still. So when that happened, I was talking to some friends of mine who was a real estate broker, and they owned a couple of real estate companies. And they said, well, they're in Goodyear. And they were like, we have a substation. And I'm like, really? I've never heard of such a thing. So I called over to the community person at Phoenix, and they said, oh, we have some in that area already. We don't need any. And I'm like, okay. So then I called like the local community guy, and I said, well, just curious, what do you look for when you have a substation? So he started listing stuff. Well, we like clean bathrooms. We like our own entrance. So I'm writing all of his things down, all I needed to know. Took one of our offices. I said, I dropped a line there with a computer that's not part of St. Joe's that we pay for separately so they could have internet. Made sure they have one bathroom for themselves, put a door together, did all of that. And then I called the lieutenant and I said, hi, I'm Lisa from St. Joseph's Hospital. See how I said St. Joe's before I said Uger, because they don't know me, but they know St. Joe's. And St. Joe's is well respected. I said, I have this great place for your officers to be able to come. And I just read off the list. I have clean bathrooms. I have an entrance for you. And I just listed what he said. And he goes, you know what? I'm going to come out and check that out. He came out and he's like, this is great. So they started coming after that. And then we started something else. And this is kind of, not many people know we did this. So there was a drowning one time, and we were watching it on TV at lunchtime. At lunch, there was the news broadcast, and it was like a little 18-month-old child that had walked into or fell into one of those washes. And we're all outraged, like, how in the world can a mother do that? How can they let that baby out? And we saw two of our officers on that station. So when they came in, we were like, what happened? And, that's awful. Like, what kind of mother? This is how stupid I am. And he said to me, Lisa, that mother's working. And the 16-year-old, or was he 13-year-old brother of that little boy was supposed to be watching him. And he was crushing cans. I'm going to cry thinking about it. Crushing cans to make money for mom. They have nothing. Now I feel this big, because I'm slamming this woman who just lost a child. So I said, well, we're going to have to do something for that family. How old is that boy? What size does he take? And it was about school to start. So we gathered a bunch of items from our staff, and we asked the officers to take it over to him and the mom. And we started a program called Happy Hearts Helping Hands. And we have a whole shelf of items that police come and take what they need for people that maybe there's a car accident or a domestic violence call. They come and they take items off the shelf and give it to the community.
That's amazing. And I was aware of that. You really need to send something over so we can send it out to the members to donate. But there was a couple leadership lessons in there I kind of want to tap into. One was you use what you got. So you knew at that moment not to use Huger Mercy to lean in on St. Joe's. The other thing is you took action. You decided that this is what you wanted to do, and you took action. And you committed to the community you're located in. You decided this is where we're at. This is, we're going to have a give back.
Wow. It was tough because we are a low income area. And another thing we do, we have Orangewood Elementary School come here. We have adopted 2 kindergarten classes, and we've been doing this close to 20 years. So the kids come here for Halloween. They do trick-or-treating here. We have a police car, a fire truck. We do a whole fall festival, a pumpkin patch. We'll do an Easter egg hunt. We do a back to school where everybody gets to pick a book off the bookmobile or whatever they're called now. So giving back to the community is huge. And it comes back to you, though. I mean, I think that was part of why we don't have a lot of vandalism here, besides having police here pretty much 24/7. And on Sunday, you can't get in our conference room because they're watching football. And I laugh because I'm like, is anybody on the road there? But we love them. But having that community, the kids know us from the time they're little kindergarten kids. The families know us because they're kind of coming with the kids, that they respect us in the community. They respect us in our neighborhood.
And you also, we're going to talk workforce shortage now. You have low turnover. In fact, I think the last time we spoke on the phone, you called because you were nervous because you had a staff who'd been there a long time leaving. And I almost started laughing because it's like you have one person leaving. You're like nervous over one person leaving, but you do have very low turnover, which leads me to the culture discussion, because we always get into is it location or culture? Is it community or culture? And I think a lot of it is culture. So how have you managed to keep a culture going, especially during COVID? Because if I remember correctly, you had very low turnover during COVID.
We did. And right now, I hate to say this, out of 11 positions on second shift, we're down 7. Wow. And we've had people leave because we've had a couple transfer to the hospital. I think the hospital has a new program going where they're doing CNAs are doing some kind of visual thing, so that we've had a couple people transfer to the hospital for that. They do 12-hour shifts instead of 8. And then we've had people that after they made it through COVID, believe it or not, they're leaving healthcare. It's like you survived the worst of it, but now you're leaving. Like even our secretary left, Joy, she transferred to another Common Spirit facility in Kentucky. So her and her husband moved to Kentucky because she got a degree. She couldn't go any further here, but she stayed within the organization. So people are staying within the organization. They're leaving my department for other opportunities. But the ones that stay here are just committed to this model. They're committed to each other. It's like a family, really. I think when you only have 48 residents on 5 acres and you have only 40 staff total, you get to know everybody really well. But then there's that fine line where you're friendly with everybody, but you're really nobody's friend, right? Like you have to keep it professional, that you can't get too involved. I've been here a long time. I have staff 15, 20 years. I know them really well. I've watched their kids grow up. We have like department parties. We'll do bowling where everybody's invited to bring your family. And even for our activities that we do on the campus, I tell everybody, bring your kids. Bring your kids, let them trick or treat here, have an Easter egg hunt, bring your kids. We want you, whether you're working or not, bring your kids. Bring your kids' friends. It's okay. You want them to always feel good about coming to work. So
is that what you attribute culture to? Because I mean, I know, because you are affiliated with St. Joseph's, I know that they have an amazing package. So I think you told me you've lost some caregivers because they got their degrees and, moved on, to other, to nursing or doctor or whatever. But I mean, if you were sitting in front of a class, what would you tell them is the top 1 or 2 things that they can do to build culture? Because I do see that is the biggest struggle, is culture coming out of COVID.
Right. I think the main thing is consistency. So first you have to, like our core values, I slam them down to everybody the minute they come into orientation. And I tell them, you can't demonstrate our core values if you don't know them. Our core values are our culture. They've been around forever. So when you make sure people know that this is an expectation, that you know these values, and if you know them, I expect you to demonstrate them. But then I have to do it too, right? So our housekeeper's off she had surgery. She's out for 3 weeks. We don't have nobody to replace her. So we're cross-training people, right? Our maintenance person is helping us. I cleaned the bathrooms in the admin office for those 3 weeks because I was here at 7 o'clock. I said, I'll clean the bathrooms. You can depend on me to do that. So everybody has to kind of pitch in. And if you're not part of pitching in, nobody else is going to do it either. So the culture is consistency and knowing kind of what the values are of the organization to make sure that culture continues.
Well, I think you touched on something, because obviously I follow Hugo on Facebook. I mean, there'll be times it's 2 a.m. You'll be like, I just stopped by the property to say hi. And I know where your building is. It's at 19th Avenue in Orangewood. And I know that you don't live by 19th Avenue in Orangewood. You're not even on that side of town. So to think that you just get into your car and decide at 2 a.m, you know what? I'm going to stop by and deliver cupcakes, I think is a lesson to all new EDs coming in, that, you've got to, I know a lot of people going to check on their staff at 2, 3 a.m. That's fine, to see if they're sleeping. But if you're going to check on them, don't be so obvious, and bring food and treats. And
well, I'll usually call ahead and I'll say, is it a donut day or is it a bagel day? So they know I'm kind of coming.
Yeah,
But
smart.
I'm giving you a heads up, but I've come in a lot of times just unannounced, just because, and I say, I'm here to support you. Is everything okay? Do you need anything? But yeah, you just never know when I might pop in.
And you also, I mean, you come from a food and beverage industry. What, I mean, I know you said that they decided you'd be good at operations to come over to Huger, but you had to take that interest to be in Huger. So why did you decide that this was the industry that you needed to be in operationally and just lifelong?
Right. I think because I worked as food service director for so many years in big, like Kivel Campus of Care. I was at Beatitudes for a while, food and service. I did clinical nutrition, and then I did food service director. So being in those big industries and big buildings, I saw what the industry was about. So when I came here just to kind of help in the interim, I was just blown away how different it was. It was not what I expected. And like, so how many pressure ulcers are there here? None. What? None? None. Okay, none. Well, what's family satisfaction look like? Well, we haven't really done a survey, but everybody's happy. So one thing I should share with you, I don't tell staff we're going to get 100% on anything. The only thing I say is we will have deficiency-free surveys because we're going to do the right thing every day, whether people are looking or not. So we're ready for a survey at any minute. Walk in today, we're going to be deficiency-free. However, I did start doing surveys after I got here for family satisfaction and for employee satisfaction. And St. Joe's does this too. We're always in the top tier, but I wish I had it right here with me. But are you familiar with Press Ganey?
Yes.
Press Ganey. I know not a lot of assisted living, but it's more acute care. But we got our Press Ganey score for 2022, and our score was 100%.
Wow.
Department. So, the families, and I don't tell the staff we're going to get a 100%, but I do show them those results. And I'm like, you did this. You guys did this. Everything that you did for that family at end of life, you made that difference to them. So when you really instill in the staff what a difference they make, I think it just motivates them to do better.
And I agree with that. But, one other thing I won't say that is unique to strong leaders is no matter how I try to put things over to you, you're quick to say it's St. Joseph's, it's the team, it's everything around you. It's never you. And I think that is reflected when you tour, because I've toured over at your community and everybody knows you, everybody stops and chats, including families.
Oh, yeah.
Families will stop, and it doesn't matter what you're doing, you'll stop. And I mean, we've had some regional meetings there and family would pop in and you just stop and talk to them. So I do think I see that in good leaders, that they're willing to share the spotlight, I guess.
Like just before we did this, I had to actually cut a tour short because I'm like, I have a meeting at noon, but they came in at 10 o'clock. And if it's 2 hours because they're anxious, they're crying, Karen, I can't tell you how many people I've toured over the years and maybe never came to Huger. And I tell people this, I'm not touring you to come here. I'm going to tour you and give you information so you're an informed consumer and you're going to feel comfortable with questions that you're going to ask in other facilities. And you're going to make your mind up because you're going to feel it. So people will call me a couple years later and say, you were the only one that stopped to talk to me. What else do I have to do? What else? Why am I here? This is why I'm here.
And you also got your doctorate.
Yeah, I did.
Was it like a long time desire? I mean, some people are just like, they always dreamt of getting a doctorate. You got the doctorate. Why did you get a doctorate?
Couple reasons. I was curious about this Arizona model and I didn't want to just do it, just from word of mouth. I wanted to really do a deep dive, which I got a chance to do. And I'll be honest with you, and Sister Margaret's aware of this too. This is a small community. I love this community. I would never go anywhere else, but it's not the most challenging when you only have 48 beds and 40 people. And Sister Margaret was aware of that and always encouraged me to be involved in the community. So I was the chair for Memory Care Alliance for a while. I was with the governors for a while with training. I've been involved in a lot of different things with different studies. And I think that was part of it, that I want to stay here. I want to learn more and I want to bring it here. It wasn't about I want to learn more and move on. I want to continue to bring stuff here. So we're actually doing another study, I think, with Dr. David Kuhn and ASU, and this is going to be Care Pro for long-term care.
Yep.
So once you get involved with certain entities, they know they can come back to you. We just started having Creighton University PTOT students come to Uger. We just started that this fall. So, you know, we have Creighton nursing students come here. They do a little rotation through here. Anything to give back. It just seems like once people know that and you make them feel welcome, can we come back? Can we bring more? It's all positive energy and it's just goodwill. So I got my doctorate to learn about the Arizona model. I learned about it, checked that off my list. Now I'm Dr. O'Toole. Nobody calls me Dr. O'Toole.
I would make everybody call me Dr. Warno. I'm not, I wouldn't even be Karen anymore. It would be like, no, why are you calling me Karen? I am a doctor, thank you.
No, it's not that big a deal.
I don't know. It sounds like to me.
It
But
was a lot,
you
yeah.
know, when people listen to this, when they hear it on replay, I don't want people to get tripped up into, oh, she's with St. Joseph's. You know, they're a big, huge healthcare chain. So, you know, they obviously make a couple bucks. Or, you know, it's Hugo Mercy and it's faith-based. I want people to understand that you've done this, you know, at other properties. It's not just here, that this can be replicatable at for-profits. It doesn't have to be a nonprofit. It's more the leader. And I mean, obviously the support of your corporate piece, but it's still the leader that's able to do this.
Well, I would laugh because if you called St. Joseph's Hospital and said, would you connect me to Hugo Mercy Living Center? I will guarantee you not one operator will know who you're talking about. And Julie's she's gonna agree with this. We had COVID and I had to bring it to our infection control and our COVID committee. The first comment I got was, Huger? Who's Huger? Like, where are we? We try to stay off the radar. And we're not expected to bring a lot of money to the hospital. We don't bring a lot of money to the hospital. We're really lucky in that being that mission-based philosophy nonprofit. If we are in the black, we're good. It's about giving back to the community. So we're really lucky that way. But a for-profit, Karen, if you saw our prices, they're half of what some of the people that I interviewed yesterday for my position, what they're charging in facilities. And they have caregivers, not CNAs. There is an 8-to-1 or a 10-to-1 ratio. It can be done. It can be done. It's just, you have to look at it. You just have to look at it from the perspective of we're all in this together. We're going to make it work and we're all going to give. That's all there is to it. I mean, if people are looking at it from a perspective of we're going to make a lot of money, which I know some smaller places are probably thinking, then they're going to pull back on services. We make things even more robust. Our activity program, I guarantee anybody, I will go toe to toe with them for our activity program because there's nobody that has activities like us. And that's where most of our money goes. Activities and food, my biggest budget.
But those are what the residents are looking for and the family are looking for is good food and activities. You know, you talk about, I can remember I worked for somebody years and years and years ago before, obviously I've never worked in assisted living. This is back to the nursing home days, but there was the executive director would take all the condiments off the table 5 days before the end of the month to save money. Now, I'm not sure how much money you save holding back on salt. I've never quite been able to figure out that dynamic. But it is interesting. However, I tell this because the executive director, I'm sorry, she was the regional. The executive director ran an amazing building. Her culture was fantastic. She spent every cent she could on activities, you know, Melanie, you know, Mel, and on all that stuff because it was very important to her. So it is possible, even in a all-tex nursing home that pulls salt off the table to save money, to have a great culture. It's the leader.
And we have all tech beds here too. I should clarify, we're not just all private pay. We have 9 out of our 48 beds, 9 are Mercy Care. We only have a contract with Mercy Care, but staff doesn't know who's all tech and who isn't. It has no bearing on care, just the billing. So it can be done. It definitely can be done, but you do have to cut corners on certain things. I mean, we used to have staff eat for free. And after COVID hit, we had to stop that naturally because we had to have masks on. And people are asking me, are we going to implement having staff eat for free? And I'm kind of like, well, with we have some registry now that I've never had before. I've never had travelers ever at Huger, ever. And we were so short on that one shift that we were actually given approval to have travelers, which is unheard of. But you have people for 13 weeks, which is good. At least they know your culture, they understand the residents. So that worked out good. But having that, you have to look at, well, I'm going to have to cut back somewhere else because it might spike my budget here, but the bottom line has to be even. So if I don't continue to have staff eat for free, I mean, they could eat with the snacks when we're doing activities, yes, but we used to give them a full meal. Like whatever the resident was eating, we were eating. So they're the little things that we're cutting back on that probably won't do. We used to have families eat for free too. We would have two husbands that would come every morning for breakfast. We just let them eat for free. And I had no problem until our chef came to one day and said, Lisa, this one particular husband, I'll call him Bill. Bill said he didn't really like the pancakes. He was asking, could I make him waffles today? So that was like, let me go talk to him.
That's interesting. But
pancakes.
Brian and I sat in on a study research. It'll be at our conference this year by CARE. And they asked staff what was important. And then they asked caregivers what was important. And it's funny you say that because caregivers ranked free food high.
Yeah.
Way high. And the managers in that ranked free food low. Like it's to caregivers, it's a much bigger deal than I would have ever thought it was.
Well, think about it. First shift would get a free breakfast and lunch. And then second shift gets a free dinner. And that saves them a good $7 to $10 a day if you had to bring your lunch or bring it in. So that's something we might consider bringing back down the road. Good to know about that study. Thank you.
Yeah, I think Mariah has it. She can send it over to you. It was, you and I, we've sat through a million studies. This one was very eye-opening. Very, like, wow, how admin thinks and how caregivers thinks. There wasn't a lot of cohesiveness, and most of it was, what admin thought was really important. The caregivers are like, we could care. Movie tickets, they don't care. Yeah. Gift cards for gas, don't care. Free food, they care.
Gas cards, they didn't think that was a big deal.
Nope.
Wow,
not that much.
That's surprising. So
yeah,
I'll have to rethink that.
Yeah, a little bit. I mean, Mariah, was there something else that you picked up on that?
I think the one that was like a big management gap versus was something about childcare or something like that. I know for caregivers, it was their big thing was insurance, benefits, things like that were really high on their list. And there was one other thing that was really high on their list. Oh, I can't remember. But yeah, there was benefits for sure. Just culture and not being heard. They feel like they're not heard. That's what it was. That's what it was. Benefits and not being heard were the big two things for caregivers.
See,
we'll share that with you, Lisa, because it really is. I mean, gas cards to me, if somebody gave me a gas card, I'd be so happy.
I thought they were the best. Yeah.
To them, it's like, no, free food and money.
See, and when you do ask staff, then you have to follow through and make sure you're letting them know what you're doing. So once a year, I have a meeting. Well, I have a meeting with staff all the time. I go to huddle every day, but once a year, I'll have a meeting.
Okay, wait a second. Now, most people call it stand up.
Oh, we do huddle.
But that's another nuance that you guys do. Everybody else is like, let's do, you're more huddle's more huggy. So, I mean, I just want to point that out.
Yeah, huddle's more team oriented.
Yeah.
Right. We're going to huddle. We're all going to
stand up. Stand up sounds like stand up and then get the heck out of here. Don't sit.
We huddle. We definitely huddle.
I love that.
But one of the things we do when I have my annual big meeting is I always say each shift, what are concerns for you? And I write them down. And every shift, so I said, okay, we write down what their concerns are. And then I say, pick one that you want to work on. And sometimes they're the craziest things. Like we had the new activity center built. When we built it, everybody has to come through the kind of the front area all the way down and around. It's quite a hall. So they said, man, if we could have a gate right here by the employee entrance, that would be great. I'm like, oh, okay, a gate. So you're thinking that's what you guys want, a gate. It would make your life a lot easier. So we had, luckily our maintenance guy at that time who just retired after 17 years. So I'm looking for a maintenance person. If anybody has a maintenance person out there. He was a welder. He took that piece out. We put a gate there with a code. And I said, okay, first shift, anybody that comes through this gate, say thank you to first shift, because if it wasn't for them, you wouldn't be able to go through this gate. So they got accolades all year for like, good job. Second shift we weren't allowing switching of shifts because it got to be like a monster. People were switching, then people weren't calling in, and it was a mess. So I said, okay, second shift, you want to have switching shifts for everybody. Everybody's going to benefit from this. We have to have protocol. What's going to be the guidelines for this so that it's fair to everybody? Okay, so they came together and came up with an idea. Well, we can switch once within a pay period, which is every 2 weeks, right? And we have to make sure that the person that we're switching with, they made a form. I'm switching with Susie. Susie signs it. We're in agreement. We put her on the schedule that way. So I said, hey, anybody that's switching now, thank second shift, because of them, you're going to be doing that. And I forget what third shift asked for, but we make sure that everybody was heard. Everybody knew what everybody asked for, what they thought was important. When we implemented it, we said this was because of them. Thank them when you see them. And that's how you do it. You got to communicate to everybody and make sure people get credit. But not everything works. Sometimes we have failures, but that's part of doing something.
That was the thing on the call, was the point that the presenter made was, yeah, you can ask them, but you actually have to put the action. And if you don't implement it or put the action to what they say, then you're not listening. You're letting them tell you. And so that was the big thing, that you can do all the surveys you want, you can do all this, but if you're not going to actually put the action together. And he talked about how they kind of did their own little group and committee to figure out the shift thing. He talked about how doing that is important and having them figure out kind of a solution to what they see the problem is, as well as perfect. So you hit on all of the boxes that he was talking about yesterday.
And I hope you guys all heard that. If you're going to ask their opinion, take action. Don't ask their opinion. I mean, if corporate says you got to do a survey and it's not going anywhere, it doesn't hurt to mention to a couple caregivers, this probably isn't going to go anywhere, but we'll survey you ourselves on it, whatever, just so they know they're heard. But getting back to maintenance man, I just sent Mariah a text because I know one of our members, Rhonda, who I can't think of who she's with right now. I'll connect you to on email because she's in and out of all the communities, so she knows who the maintenance folks are. So she'll know if anybody's looking. I just can't think of, I'm sorry, Rhonda, I can't remember your company.
She's with Tolan Mechanical. They do like HVAC stuff.
Thank you. Tolan Mechanical. Thank you. Mariah redeemed me. Okay, as we get ready to wrap up, I have a couple questions. The first one would be, where do you see assisted living and memory care, because that's mainly your specialty is memory care. Where do you see us heading in the next couple of years, say 3 years down the line?
When I came to Arizona like 20 some years ago from Pennsylvania.
Yay, Pennsylvania. Go Steelers.
Go Philly. I mean, go Eagles. I was kind of shocked that we were so far ahead than Pennsylvania, because I thought the East Coast was like ahead of everything. And I was like, wow, assisted living in Arizona. They oversee education. They make them take these classes. I mean, I was in awe. And I'm seeing as time goes by, things are being kind of stripped back. Like the education piece isn't even required anymore, although we do it. The classes to be a caregiver are fewer, less hours. And I know it's the times that we're in, we're really desperate for help, but I really wish assisted living in general would elevate the caregiver instead of dumbing it down. And I think we're dumbing it, and you may disagree with me, Karen. I think we're dumbing it down instead of saying this is a profession you want to get into. Even CNAs, like they used to have like schools that you would be a CNA and LPN. Organizations would go out to school and kind of promote these jobs, these professions, these skills. And I'm not seeing that anymore. But again, it's a generation with digital and computers and remote. So I don't know. There's still people out there that have heart that want to do it. I just wish we elevated it a little more so that assisted living, I think, was respected more in the industry.
Yeah, and I think, I mean, caregiver training is getting ready to go back online. As you know, when the governor's emergency order expired, probably by summer, caregiver training will be back online. And I think once it gets back online, you're going to see some of the stuff that kind of went away during COVID or that everybody thought was a great idea is going to get re-implemented. It just, you know, I think COVID changed a lot.
Mhm.
We probably would have never got online caregiver, although you can get your doctorate online, but for some reason you couldn't get your caregiver's, you know, certificate online. I think that will kind of change, but you're right, because, you know, Pennsylvania just now in the past 4 or 5 years regulated assisted living.
Mhm.
I mean, they always had a category, I think they call it personal care homes back there, but you couldn't do much. So when, you know, when it was time for my mother to really have to leave assisted living, we had to put her in a CCRC so we could just move her, you know, across the hall versus building to building. So Arizona does lead in healthcare. And I think it did start back with the Arizona model.
I really do
Before that,
too. That
yeah, it
started
was all
assisted
nursing
living.
homes. Yeah, I really did think that was the birthplace. Okay, so my last question, and if anybody else has any questions, let me know. For comments, Catherine Halprin. Hi, Catherine says, hi, everybody. Sorry, I'm not on camera now. So happy to be here. And Mary Sue, hi, Mary Sue says, thank you, Lisa, for your leadership. Bravo. We all applaud. We're big fans of Lisa. So if you are sitting in front of a new ED and they're asking you questions, what would be, you know, the the tips that you would tell them that will lead to success that they're not going to pick up in a book?
Ooh, a couple tips to a new ED. I would have to say, be genuine and bring yourself.
Oh, I
to the
love
plate.
that.
Be genuine. You know, if you have a question, ask the question. If you don't know something, it's okay. Don't try to, I know people say fake it till you make it, and that's okay to a point, but really be genuine to the people that you work with and, you know, to the families, to the residents, just be really genuine, because I think sometimes, I think especially women, I think we try too hard sometimes because we have to prove ourselves. I think if we could just be who we are and let that shine through, I think you would be successful, because if it's coming from the heart, it'll work. And the other thing I would say was just try to stay objective and impartial, because I've worked in a lot of places where there have been cliques and that manager got involved with that. There were favoritism, and it's like, you hear it all the time. This is my favorite. That's my favorite. You don't want any of that. So you want to be really black and white and transparent with, you know, this is a policy. I tell everybody my job is the easiest job in the world. It's policy driven. All I have to do is show you the policy. I mean, it is what it is. Will I work with you? Why are you late all the time? Okay, do you need a bus pass? Do you need me to get you a metro rail pass? I can do that for you. I want you to be successful. So other people's success will be your success. Really strive to make other people successful and not for your success, because when somebody else is successful, everybody's successful.
Yeah, and I agree. And I have to say, it doesn't hurt to make a good first impression. I can remember the very first time I met you at your community. Crystal and I came for a visit, and you know, we had a little snacking, and you're like, do you guys want some ice cream? And we're thinking, sure, this little thing of ice cream would be so great. You brought out one of those big, and it's like, this is what we give everybody. I think it was a pint of ice cream. I'm like, what do you want to do with a pint of ice cream? But to me, it was like so marvelous, because it's like, here, you know, here's our, it's just those little things that resonate with people. But
Yeah.
I thank you so much for taking the time for doing this. I've valued our friendship over the years. I have watched you from afar as, you know, Hugo Mercy has taken off, and watched your leadership and probably been your biggest cheerleader. I hate to see you leave the industry, because it's going to create a void that I don't know will ever be able to be filled. But you've done amazing work. And when you leave, you will leave a lasting memory, and you've impacted so many people's lives over the years. And I know that we're all blessed to know you. If anybody has any questions, put it in the comments real quick. Mary Sue says, totally agree. This is a servant leadership class. Oh my God, it really is.
It really is.
It really is. We're going to box this up and sell it for give it away for CEUs. So if that's it, you guys, thank you so much. Lisa, thank you so much for taking the time to do this. I will send you Rhonda's numbers, Courtney's number, and if you need anything else, when's your last day? Are they gonna have a big party for you?
It's in April. I'm not sure when in April because I have to hire somebody and I'm allowed, Sister Margaret again has given me a whole month to train somebody. So, I get a chance to really sit and get somebody in here and organized. So I'm thinking sometime in April. I would assume that Virginia's planning some kind of little shindig.
Well, tell her not to do shindiggy until May, because you got to come to our last conference. Come on.
Yeah, I know. I haven't.
I mean,
missed
Mariah's
that.
like, when are you kicking up to conference, Karen? You got to come to that. So just leave in May and then maybe June. We'll figure
Okay.
it out. Okay, thank you very
Thanks.
much, you guys. If you want to watch this, a replay, it'll be on LinkedIn, on our Arizona Alpha page, LinkedIn, our Facebook page, and also on podcast. And if you know anybody interested in being on this podcast, please let me know. We are on hiatus now until after our conference. We'll be back in May. Everybody have a great day. Lisa, thank you so much for taking the time. This has
Thank
been
you.
fantastic.
Thank you so much. I really appreciate it. And thanks to everybody.
Everybody have a great day. Thank you, everybody. Bye-bye.